Numerous bills on AIDS research and autism and diabetes, all of which passed and became law. What we didn't get done was some of the major things, because in the Senate it takes 60 votes to bring it up for a vote, and we never had 60 Republican votes in the Senate.
That's right. I'd like to add, if I can, that Republicans made sure we included research and development as part of what we did. And over the last 5 years, each of the last 5 years, fewer people have died of cancer than the year before.
We doubled the NIH budget.
Doubled the NIH budget. We have also seen the advantages of health care that have come as a result of fewer people having heart attacks. And that has dropped a lot as a result of research and development. It's how you go about spending your money, and Republicans spent a lot of money on quality of health care. And quality of health care means that we have the advantages where you have a system that is generally understood, where a person all across the country can get better health care because of research and development, and so a lot of people, and health care's gotten a lot better.
Is there a Republican plan, or several Republican plans, if there are, to deal with the problem of insurance? I mean, do you guys have what you think is a solution to this problem?
We have a number of Republican alternatives. We do not have a comprehensive 1,400-page alternative because we don't think it's necessary. We did offer it, and I think they did in Ways and Means too, Senator. But
well, what we've done is there are two plans out there on the Republican side, neither of which have been scored. That means that they don't know the cost because the committee that scores them hasn't been allowed to score them by the Democrats. So we don't know what the cost is. And in both cases, I think it's a heck of a lot less than what you're looking at.
But on the two big, what are generally considered to be the two big issues, which is people that would like to have health insurance and just can't get it under the current system. The alternative was offered by myself in the Energy and Commerce Committee as a Republican alternative, that we would cover everybody in America with pre-existing conditions. We would create a national and a regional pool similar to what they got out in Lubbock. Anybody could join, their pre-existing condition would be covered. Depending on their income status, they would get a refundable tax credit if they were working, or a voucher if they were unemployed, so that they could pay for the care. On the physician side, we offered that we would do away with the current SGR system for physician reimbursement, put in a permanent fix. This was offered by Congressman Burgess, Judge Whitley's congressman from Denton County and North Tarrant County. That would cost in the neighborhood of about $20 billion a year. And then to go to some of the things that Mr. Allison was talking about, we offered an amendment that would require transparency in the system so that everybody would have to report what their charges were, what their quality results were, and what their access limitations in terms of waiting periods and things like that. Those would have to be posted in a public, transparent fashion so that anybody wishing to get information about which is the best insurance plan, the best doctor, the best hospital, the best outcomes for prostate surgery or whatever, would have access to that information. The doctors would have that access, the patients would have that access, and it would be available in a fashion that you could understand. All those amendments were rejected by the Democrats and the Energy and Commerce Committee.
Gentlemen, if I could, Dr. Goodman, for those who want to do their own online research, I'm aware of at least 3 freestanding Republican bills that encompass most of what Joe spoke about. H.R. 3218, Improving Health Care for All Americans Act, introduced by Congressman Shadegg of Arizona, that I believe serves on Joe's committee. H.R. 3400, Empowering Patients First Act, sponsored by Dr. Tom Price of Georgia. H.R. 2520, the Patients Choice Act, Paul Ryan of Wisconsin. So there are a number of Republican alternatives out there. I would encourage you to do your
Okay, Eddie McBride, I mean, you've heard what they just said. I mean, is any of this going to bail out small business, make it possible for small employers to survive in this market?
Well, depending on what particular parts of the plan does get implemented, one of the things that has to be cautioned, this cannot be put on the backs of small business, because obviously, as I said earlier, you know, the small businesses have led us out of the last 7 recessions, and the more surcharges, the more taxes, the more mandates that you place on small business, you will cause them not to be able to lead us out of this recession. And that's what we're concerned about, is because what is the problem with free market enterprise? What is the problem with capitalism? Why can't we stay with the private options that allow us the opportunity for small businesses to grow as opposed to being held back?
Let's take a couple of philosophical questions. Somebody asked, shouldn't everybody be required to have health insurance? Shouldn't this be mandatory, just like you have to have a driver's license to drive? Shouldn't you have to have health insurance if you're going to use hospitals and doctors?
If you want to.
Well, I guess it kind of goes down to, is it a right or a responsibility, and whose responsibility is it? And I do not believe in a free society that we should tell people or dictate what they should do.
There is a difference between car insurance and health insurance. You have to have a license in every state in the union to drive a motor vehicle. That motor vehicle is a potential threat to other people on the road. You don't have to have a license to live, okay? If you live a life that is exemplary and kind of take care of your own business, you're not normally going to be a threat to anybody else. So there are differences. And then the last thing is, in spite of the fact that every state but 1 or 2 of the union has mandatory requirements for car insurance, about 15% of the populations in those states don't have car insurance.
Dr. Goodman, what we should do is give every single person the best opportunity to be able to have health care if they would choose to have it. Whether you get into asking, is it a right or a responsibility or a requirement that you have health insurance, the answer should be that what we need to make sure is that for anyone that wants it, that it is as cost effective as possible and everyone would have the same opportunity or chance, and that we would have a quality healthcare system that would be run by the free enterprise system to accomplish that.
This is a related question, and Sam Johnson, it's addressed to you, but any of the 4 of you answer if you like. The question wants to know if we as a society have a moral obligation to provide people with health care, or more generally, what are our responsibilities to other people with respect to health care?
Well, my view is, again, this is a free enterprise system that we have here. If you want to have health care, you deserve to get it. If you don't want it, you ought to be able to not have it. And if, in effect, later on, you have a health problem that we have to take care of you, somehow you need to help fund it.
End of story.
Now,
Dr. Goodman, let me just make a comment. I had one of the things that they're talking about is you won't be able to get a doctor when you, if this thing goes through. You'll have to wait in line.